When patients ask me what kind of method of implantation is the best in FUE, I really get a slightly professorial, and I try to explain to them there are so many different kinds of mechanisms, so many different kinds of techniques which you can use for implantation. Implanter pens, Choi implanters, Sava Plus implanters. There is Sapphire tip which are used to make recipient sites, Forceps based implanters, and keep implanters. There are so many different types. We're going to discuss all of them in this video, and you'll come to know pros and cons of each of those and what it means for you when you choose a particular technique for implantation. Now you're going to ask me why implantation matters so much. Implantation is the final step in your hair transplant, and it's the most crucial step. Here is the part where you get your hair angles placed correctly, the density is placed correctly, the hair direction is placed in a right manner, and while implanting, performing surgeon has to check that he is not doing excessive damage to the hair grafts. At the same time, you have to also preserve the blood supply of the skin. So all of these things are to be taken into consideration when you are doing implantation, and implantation is one of the most important parts in a hair transplant. First method of implantation is probably the commonest used in around the world. It is Forceps method of implantation, where surgeons make pre-made incisions on the patient's scalp wherever the grafts have to be planted, and the part where the slit is made, that is quite different in different centers. Wherever there is a normal blade used, it is called a pre-made blade, pre-made incisions by a blade, and wherever there is a sapphire tip on that blade, that is called a sapphire tip for making a recipient site incisions. Now, why sapphire tip is important is because it makes very sharp and very precise kind of slits, which minimizes the skin trauma, and it improves the healing, and it minimizes the scarring. That's why the sapphire tip is so much promoted, because it is so sharp. But the method of implantation which sapphire tip is based on is called Forceps implantation. This is the process where the technicians hold the grafts into the small tiny forceps, and they hold it and plant them one by one into the pre-made slits or pre-made incisions in the planted area in the recipient site, either by a blade or a sapphire blade. This is what is called as Forceps method. Now, pros of this method is fairly simple. It is very cost effective, very straightforward. It requires a lot of technicians, it requires a lot of staff in the OT, but if 4 or 5 people are working together, this can be a very fast method and very cost effective method. Cons, I would say there is very high chance of graft manipulation, because you're going to hold the grafts with the forceps and you're going to pinch them here and there, and depending on the technician's perspective, technician's training, is going to hold it. Sometimes they crush the grafts while loading the grafts inside the slit. So technically, sometimes it's difficult to keep an eye on your technicians, because you have to understand technicians are not surgeons. They are trained assistants. They are there to perform the graft implantations on your behalf. So a lot of times what happens is technicians, if they are not in the mood of doing very good implantation, they might use a very harsh force. So that can result in graft getting crushed, and crushed graft means either the graft will fail to grow or it will grow in a very tortuous manner. Eventually, when the hair grows out, it might look a little bit curvy, or sometimes it will fail to grow completely. Here the advantage of sapphire tip is pretty straightforward. Sapphire tip makes the incision very precise and very sharp. And in surgical fields, a sharp and precise cut always heals very nicely. The only downside to the sapphire tips is the cost of the sapphire tips, because it is a disposable tip. And every time you use it on a patient, you have to throw it away and get a new one. And sapphire tips are quite expensive. So that's going to add to your cost of the procedure. But sapphire tip is not a different type of implantation. It is just Forceps method of implantation, where rather than a regular blade, a sapphire tip blade is used. Second type of implantation is probably the most oldest one amongst this list, and that is called stick and place method. And sometimes they do use forceps as well, but stick and place method is basically where you take a needle or a surgical needle and you make a slit with that needle. At the same time, with your left hand, the forceps, you place the graft inside and manipulate the graft inside the skin. Now, one of the biggest advantages of this procedure is it's so cheap, because needles you get it for like 1 rupee, but the technical skill required is pretty high. Not everybody can learn it so fast. So the pro being it is cheap, the con being it has a distinctly tough learning curve, and also sometimes it leads to graft popping, and some cases like where there is skin which is a little bit tough or scarred skin, stick and place method becomes very hard to do. And bypass to this method is making a pre-made incisions. But if you do make a pre-made incisions, then you defeat the whole purpose of stick and place method to begin with, and pretty much it comes down to, again, you are using the forceps method for implanting. So that's your stick and place method. Implanter pens is the next method of implantation. Now, implantation pens are so popular in South Korea and Southeast Asia because of the speed at which the implantation is performed. I have a little bias about this because I personally like using implanter pens. There is a definite pro of implanter pens that you have a technical superiority. The grafts are not damaged because it is a one action. Another type of implanters are called as keep implanters. They sort of bridge the gap between forceps as well as the sharp implanters and the ones which are disposable. Keep implanters, on the other hand, are blunt and they are not disposable. They are used multiple times. They do require us to make pre-made incisions in the skin, and when the graft is loaded in the keep implanter, you have to place with a forceps and you have to shove the graft inside. So, pro of this method is, of course, this is a modified method of almost, you can say, it is a bridge between forceps and implanter pen. It's quite easy to learn. That's probably the most easiest learning curve amongst all the implantation methods. It's quite easy on the team. Cons is keep implanters are on the costlier side. The only good part about them is because they can be autoclaved and reused. Ultimately, the cost becomes slightly manageable. Ultimately, whatever type of implantation method you use, it is the surgeon whose skill is the most important, not the implantation type. But if the surgeon is primarily involved in the implantation part, then the surgeon is able to give the results. Now, this is pretty difficult when you do forceps method of implantation, where surgeon alone cannot do everything. So technician has to get involved. It all depends on how the surgeon is managing the technician team. In other types of methods like stick and place, also the surgeon and his team is working together. The implanter pen system, where implantation is actually done only by the hair transplant surgeon, is probably the one where the hair transplant surgeon is fully involved in the implantation part. And that is the reason why it's my favorite technique of implantation. And if I ever get a hair transplant done, I would rather get a hair transplant done from a center who does implanter pens. That's why I believe in them. Now, these pens why are they so popular is because they provide the fast implantation. It's the most rapid kind of implantation that you can achieve. Another advantage is you are in the full control of the direction, angle. It's almost like painting a canvas when you are taking the graft and implanting in whatever direction, whatever angle a surgeon deems to be fit. They are much more challenging to learn. They are the most difficult to learn, I would say. Once you get that past that learning curve, implant pens are probably the best method of implantation. Now, I might be a little biased towards them because I use implant pens all the time. My favorite implant pens are Choi pen, and Choi pens are made in Korea, And the only downside to the Choi pens is the mechanism is pretty complicated. Now everybody cannot learn this fast enough. Of course, on top of that, the cost of implanter pens, because these are disposable pens, is pretty high. Now we do have an Indian option for this implant, which are very similar to the Choi implanters, and they are actually quite simpler in the design. And those are called Sava Plus implanters. And these are my favorite actually, because they are cost effective, they are very sharp, and they are notoriously cheap but yet high quality. And what we do is basically put the grafts inside those needles, and there is a team of 4 assistants which they sit beside me, and they keep on loading the grafts, and I pick the implanter one by one and I implant them into the patient's skull. This by far I have found is a really nice method of implantation. You achieve a very good density, you achieve a very good angles of the hair and very good directions, and at the same time you do not damage the grafts enough, because the graft manipulation while doing the implantation is at the minimum. So this is probably my favorite method, so that's why I am going to be biased against this. But all the other methods are equally effective and they do provide equal results. They do have their pros and cons, and one of the things you should know is whether it is a forceps method of implantation, whether it is implanter pen implantation, the surgeon's role is of paramount importance. It's not that if the surgeon goes away, implantation can be handled by technicians. I see that happening a lot of times in most of the hair transplant centers nowadays, but it's not a right thing to do, that you hand over the implantation part completely to the technicians. And technicians, if they are good enough, they will do it right, but they are ultimately not surgeons. So they don't have vested interest in giving the patient the best results. So you've got to understand this point. Implanter pens, whenever they are used, they are almost always done by the surgeons. Rest all the methods can be done by technicians. Since implanter pens are costly as well as they have a very steep learning curve, most of the times the implantation is done by the hair transplant surgeons. That's the reason why I promote my hair transplant surgeries as surgery done by hair transplant surgeon and not technician, because I do the implantations myself. But if you're a patient researching your options, ask your surgeon which method of implantation they are using, and not just what device or what hi-fi technique they are saying. Ask about these particular techniques. Ask about how much of a surgeon is involved in the implantation part of the procedure. You will come to know what kind of the procedure is done in this particular center. And if you found this information useful for your hair transplant journey, please subscribe, because I'm going to post a lot of informative videos about hair transplant on this channel. So for more updates about hair transplant and all the information about hair transplants, please subscribe to our channel.